Scenario summary. Patient, 3-year-old male. Setting, emergency department. Issue, accidental ingestion of 2-3 tablets of Celesta 40 mg. Timing, 45 minutes prior to arrival. Course, asymptomatic, normal exams, poison control consulted, 6-hour ER observation, serial EKGs, discharged home. ICD-10-CM diagnosis codes. Primary diagnosis, T50.901A, poisoning by unspecified drugs, medicaments, and biological substances, accidental, unintentional. Initial encounter. Rationale. The documentation identifies accidental ingestion of a medication. Celesta is not clearly categorized in ICD-10-CM as a specific drug class, e.g., opioid, benzodiazepine. When the drug class is not explicitly defined, T50.901A is appropriate. 7th character A is required because this is the initial encounter for poisoning. External cause code, secondary. X40. Accidental poisoning by and exposure to non-opioid analgesics, antipyretics, and antirheumatics. Optional, payer dependent. Rationale, used to further explain how the poisoning occurred. External cause codes are not mandatory for reimbursement, but are often required for pediatric cases, quality reporting, public health data, place of occurrence, optional, Y92.009. Place of occurrence, unspecified home. Place of occurrence, optional, Y92.009. Place of occurrence, unspecified home. Rationale. The ingestion occurred at home. This code adds contextual detail but does not affect payment. Activity code, optional, Y93.9. Activity unspecified. Rationale. The child was not engaged in a defined activity, e.g., sports, often omitted unless required by payer or state reporting. Codes not assigned, with rationale. No symptom codes, e.g., nausea, vomiting. Patient remained asymptomatic. No Z91.89, non-compliance. This was accidental, not neglect or misuse. No adverse effect code. This is poisoning, not a therapeutic adverse reaction. CPT, HCPCS procedure codes. Emergency Department, EM, 99284. Emergency Department visit, moderate severity. Rationale. Poisoning ingestion in a pediatric patient. Required poison control consultation. 6-hour monitored observation. Multiple EKGs. Meets moderate MDM despite stable presentation. 99283 would generally be too low given the risk profile of pediatric ingestion. Electrocardiograms. 93,000. Electrocardiogram, routine ECG with interpretation and report. Units, 3. Rationale. 1 EKG at admission. 2 additional EKGs during observation. Each EKG was performed, interpreted, and documented. If provider interpretation was not documented, payer may require 93005, tracing only, or 93010, interpretation only. Observation coding. Do not bill observation CPT codes 99218, 99222. Rationale. Observation occurred within the ER. Patient was not formally admitted to observation status. ED observation time is bundled into the EDEM code. Coding logic summary. Category code. Why it applies. Primary DX T50.901A. Accidental medication ingestion. Unspecified drug. External cause X40 describes accidental poisoning. Place Y92.009 occurred at home. EM 99284. Pediatric poisoning plus monitoring. EKG 93000 X3 serial EKG monitoring. Final notes for coders. Always confirm drug classification before defaulting to T50.901A. Pediatric ingestions almost always justify moderate MDM. ER observation, observation admission, serial diagnostics must be documented to bill multiple units.